Okay, our next topic is about major nerves. We have studied all the arms, forearms, and hand muscles. So, how they are innervated, we'll learn that. So, they are innervated by major nerves. As you can see, we have studied the brachial plexus. In brachial plexus, there are some major nerves which are only and only giving branches to our arm, forearm, and hand. Okay, so which are they? They are radial, ulnar, medial, axillary, and musculocutaneous nerve. Okay, musculocutaneous nerve, axillary nerve, median nerve, ulnar nerve, and radial nerve. They are the major nerves, okay, which are coming to our upper limbs. Let's make a note. Okay, so major nerves which are supplying to arm, okay, forearm, and hand. So in arm, we have anterior compartment, we have posterior compartment. In forearm also we have anterior compartment, we have posterior compartment. In hand we don't have any compartment, we have only 20 muscles. So see, there is a one rule. To the posterior compartment, only and only radial nerve will supply. Radial nerve. Okay. Only and only radial nerve supply to the posterior compartment. It can be arm or it can be forearm. Next, to the anterior compartment of arm, there will be musculocutaneous nerve. Okay, anterior compartment is taken by musculocutaneous nerve in the arm muscle. In the forearm, which will be here, here will be ulnar nerve and medial nerve. Okay, ulnar nerve to the lateral side and medial nerve to the medial side. And in the hand also, there will be ulnar nerve and median nerve. Okay, let's see how they are coming and giving the. First, we will learn about musculocutaneous. Musculocutaneous nerve. Musculocutaneous nerve. Okay. So musculocutaneous, let's see the origin, okay, and the branches of it. So musculocutaneous, as you see here, we have learned in the first video of the brachial plexus, it was that it is coming all over the lateral cord. It is the branches of lateral cord, LML, L for lateral branch of pectoral nerve, M for musculocutaneous, and L for lateral branch of median nerve. So it is from lateral cord. The origin was C5, root value C5, C6, and C7. Okay, and it is supplying which muscle? Yes, anterior compartment. What was present in the anterior compartment? We have mnemonics B, B, C muscles. Okay, insertion, no, supplies to BBC muscles, biceps brachii, brachiocephalic, brachialis, and coracobrachialis. Okay, and the origin is lateral cord. Root value C5, C6, C7. Okay. So next, this is the motor supply. Okay, these are the motor supply. But over here in the brachiocephalic, in the brachialis muscle, it is only giving branch to median part of the brachialis. Okay, so and in the sensory, this is this, and in the sensory they are giving branches to the cutaneous, like also supply as a cutaneous to the arm, in the forearm, cutaneous to the skin. It is named as musculocutaneous, right? Muscles here and cutaneous here. Okay, now, so in the musculocutaneous, it, for example, we are having coracobrachialis muscle. Yes, in the arm we have coracobrachialis also. So it is coming all over the. It comes to the piercing to the coracobrachialis and enter the arm. Okay, and brachialis, as said, the median part is supplied by the musculocutaneous, and the lateral is supplied by the radial nerve. So this is known as composite muscles, or you can say the second name is hybrid muscle. So brachialis, medial part is supplied by musculocutaneous nerve, and lateral part is supplied by, yes, our radial nerve, and that's why this is named as hybrid or composite muscles. Okay, there is one more thing that this is our humerus, lower part of the humerus. Okay, and so here what I want to say you that, for example, in some of the people, not every, few rare case. So this is the distal end of the humerus, and here is supracondyle. Okay, so sometime what happened, there is third head of the biceps comes and attach the medial epicondyle. Okay, sometimes in some, whereas this is only seen in the animals, but in some humans, if it is present, it is known as Struther's ligament. What is Struther's ligament? It is present in some of the people, very rare case, coming from the supracondylar and insert to the medial epicondyle. This is lateral epicondyle. Okay, so why I'm saying you about this? Because sometimes, because of these, we have here medial nerve and we have radial artery. Because of this presence in some of the people, these nerves and artery get compressed and they are having Struther's syndrome. What will happen in Struther syndrome? They will have pain, tingling in hands. Okay, because we will see the median nerve is supplying to the arm and hand muscles, right? Arm and hand muscles. So we can see pains and tingling sensation in the hand. Okay. Now next.